Well, good afternoon, and thank you for being with us today. My name is Carla Chenier, and I work for Families Helping Families of Southwest Louisiana. Welcome to the Developmental Disabilities Tiered Waiver Services webinar. Before we get started, I want to give my coworker, Melinda Elliott, an opportunity to tell us about a very important program here at Families Helping Families. Melinda.
Thank you, Carla. So my name is Melinda Elliott. I am the LaCan team leader for Southwest Louisiana. I cover Calcasieu, Cameron, Jeff Davis, Allen, and Beauregard Parish, just like the Families Helping Families Center in this area. So LaCan stands for the Louisiana Council Advocacy Network, and it's a grassroots network which links lawmakers, people with disabilities, and family members to make positive change in systems that serve people with disabilities. We advocate for people and children with disabilities to be included everywhere that you live, learn, work, play, grow old. We want a system where they're going to be supported to live in their own homes, to be fully included and participating members of the schools and communities. There's actually 10 regions, but there's 9 LaCan leaders like me. There's one of them that serves both regions in the New Orleans area. And we provide connection to a regional team of advocates. So there's probably 700 people on the team here. I'm sure there's various numbers on the team in various parts of the state, but we all work together as one unit on proposed policy changes and, well, letting people know how those changes affect you if you have a disability or your child and other people. We provide training on skills to effectively advocate for systems change. But the very most just important thing that I do is hook you up with your lawmakers. I hook you up with our legislators through individual legislative visits, through a yearly legislative roundtable, through possibly talking to legislators in a committee and telling them about things that are important to you. We work on a legislative agenda every year. We're working on ours this year. We have a couple of proposed things, but the Louisiana Developmental Disabilities Council itself makes the ultimate decision, and they will do that in October. So if you have some real good ideas, you still have time to get them in. Wallace has put the link to join in the chat box. It doesn't cost you anything. All you're really doing at this point is saying, I'm willing to get emails and learn about how this works and what's going on. Of course, at some point, I'm hoping you'll send emails about things that are important to you. Do you have any questions? Let's check the chat box real quick. Nope, that's Wallace hooking you up. All right, then. I think I'm done, Carla. Back to you. Carla, I believe you're still muted.
I'm sorry. Thank you, Ms. Melinda. We are pleased to welcome our special guests, Marla Crater and Snow Garrett. Marla is an RN, medical certification specialist, and the regional office specialist for MCAL. And Snow is the medical certification specialist waiver supervisor for MCAL. Today, they will be sharing information on waiver services. I want to make you aware that this webinar is being recorded. Marla and Snow will be answering your questions at the end of their presentation. Please send your questions by entering them into the chat box. For the purposes of sound quality, everyone will be muted for today's webinar. I want to let you know that when we finish this webinar, you will be prompted to complete a post-event survey. With that, I want to welcome Marla Crater and Snow Garrett.
Hello, I'm Snow Garrett. I'm the waiver supervisor with Imperial Calcasieu Human Services Authority, or MCAL HSA for short. This is Marla. So we're going to be tag teaming on this presentation. It is a more concise, condensed version of our tiered waiver process. And we do ask for questions at the end, please, so we can get through all the slides to get you all the information. Okay, my slides are showing. Yeah. Okay.
Yes, they're showing. And you mentioned that you will email us the material that you would like to share and resources in the PowerPoint at the beginning of next week. So it'll be the beginning of next week before we get it to everyone that's attending.
That's correct, Wallace. We will get together this slideshow as well as the fact sheet and any other information we feel would be helpful to go along with the presentation, if that's okay with everybody. Okay, so today we're going to be discussing or presenting the tiered waiver process. This is information on how to access our OCDD waiver services. And this is the Office for Citizens with Developmental Disabilities, because there is another waiver program with the Office of Aging and Adult Services. That's a different office, different agency with different guidelines. So we're talking specifically in this presentation about the OCDD waivers. We're going to provide information to you on the 4 waiver programs, and we're also going to give an overview of the tiered waiver process. I want to start out by saying we are MCAL. We're a local governing entity, or LGE, which means that at some time years ago, the transfer of control and power management of our services came to the local level. We used to be under or directly with Office for Citizens with Developmental Disabilities, LDH. We do have our own board who consists of a person from each of our 5 parishes, which are nominated by the police jury. And we also have 3 governor-appointed board members. Our executive director is Tanya McGee, deputy directors Jenny Mills, James Lewis, who a lot of you know if you may be a family member or a provider. James Lewis is our DD director, and Leslie Nolan is the behavioral health director. Okay, first of all, to qualify for any of our DD services, including our waiver services, the individual has to have a diagnosis of a developmental disability, which means they have to have had a severe chronic disability with intellectual or physical impairment that occurs before the age of 22. It's likely to continue indefinitely and may not be contributed to a mental illness diagnosis. So with the developmental disability, they also have to have substantial limitations in 3 or more life areas. For instance, their self-care, receptive and expressive language, learning, mobility, or the general capacity for living independently. And those are just some of the criteria for the functional limitations that are assessed. Some examples can include autism, Down syndrome, cerebral palsy, intellectual disabilities, just to name a few. So our entry unit here at MCAL is the single point of entry. They will conduct assessments to assist with determining eligibility for DD. And at that point, let me go back. The assessments are conducted, they must be conducted face-to-face. Interviews and assessment is conducted for the DD diagnoses, but we don't determine the diagnoses for like autism, for instance. And they do collect documentation that may support the diagnoses of autism. So once they determine eligibility, a statement of approval is issued that says they're qualified and they meet the criteria for a DD. If at that point the family or individual is requesting waiver services, they would inform the entry unit staff, and their waiver services request will be entered into what is called the RFSR, or referral for request for services registry. This used to be called our now waiting list. And once their name is put on the RFSR, a screening for urgency of need is what will take place next. So in our screening and linkage process, like I said, the individual who's requesting the waiver services will be added to the list to have a screening, and the screening is called the screening for urgency of need, which are administered by OCDD. So at the state office level, they do have a team with, I want to say 7 or 8 individuals, and they go statewide. I don't think we have anybody locally that do the assessment, but they go statewide to conduct these assessments and schedule those with family members. Once the SUN assessment is conducted, if the individual receives a score of a 3 or 4, then they are placed on the RFSR to receive the next waiver offer. Statistical Resources Incorporated, or SRI, is the state data and registry contractor. So once they are informed, and this is through their electronic system from OCDD to SRI's database, once SRI is informed that someone has scored a 3 or a 4, they will be issuing or mailing out a freedom of choice for support coordination. They will mail that out to the individual or to their family member. Once that individual or family member receives the freedom of choice form, they can select an SC agency at that point. Here in Region 5, we have currently 3 SC agencies. So once the family has selected who they wish to provide their support coordination for the waiver, they would return that form to SRI, and SRI has multiple ways. They could fax it, email it, or mail it in. And then at that point, when SRI receives the signed freedom of choice form, they are linked to the chosen support coordination agency. Once they are linked, our office, the LGE, and the chosen SC agency are notified via email. When the SC agency receives the linkage, they do have a timeline that they have to follow, and they begin their contacts with the individual. At that point, the planning for the waiver services begin. Okay, also in our office, we have other non-waiver services for people with developmental disabilities. And again, they have to meet the criteria to have a DD. We have a family supports unit that provides individual and family support. They provide assistance not available from other resources to allow people to live in their own homes in the community. They are based on a priority system. There's priorities 1 through 4. And it's also dependent on the amount of funds that are available. There's the Flexible Family Fund, which provides cash stipend for families of children 0 to age 17. who have severe disabilities in order to keep them and to support them in their home. The monthly stipend is $258. Again, that's only through the age of 17 that that's available. There is a waiting list for that because there's only a certain amount of slots for the flexible family funding. There's also residential options, meaning people who wish to live in a community or group home. And of course, those individuals do not qualify for waiver services. Also, we put on here Early Steps. It's another agency and program for young children birth to 3 years of age. Here's the 800 number to access Early Steps. Another resource from OCDD, and you do not have to be on a waiver to access this resource, and they're just a tremendous team. We've been working with them on numerous cases, especially lately, is our OCDD Resource Center. It's a team of psychologists, social workers, there's a nurse for each region. They provide allied health, physical therapy, occupational therapy. There's an assistant to the psychologist or ATAP. They also provide dietary services. Am I missing any other
No,
profession on
just
there?
on that, the physical therapy and occupational therapy are not actually provided. It assesses for screening and you know, kind of the gateway to speaking with your physician. And then they also can access the home to see if there is any environmental modifications or equipment that could help the individual to become more independent in their home setting. But it's not actually them performing the physical therapy or the occupational therapy.
They'll also provide support to the family and education to the family, support coordinators and providers. This team works very well with the provider agencies, families, and individuals. I just wanted to let y'all know that we do have this resource. You don't have to be a waiver participant to access the OCDD Resource Center. Okay, so to our waivers. Our waiver programs, you may see this acronym a lot, HCBS. They are a Medicaid home and community-based services. They're part of the home and community-based services, which also includes the other waivers like the Office of Aging and Adult Services that I mentioned, and long-term personal care services through Medicaid. The waiver opportunities are dependent upon funding. They're also offered based on need and priority level. As I mentioned previously, priority level meaning the score that's received from that SUN assessment. The planning for the appropriate waiver does require person-centered planning, and there's also needs-based assessment depending on which waiver program, and Marla will talk more about the planning process in a few minutes. The waiver, like I said, the tiered waiver system is based on planning, and with adults, we use that planning process to determine the most appropriate waiver. The waivers are designed to promote independence, the individual's choices of what kind of services they wish to receive, the amount of services, the location of the services, whether it's in their own home, if they're living with their family, and it's to provide integration into the community or community inclusion. And individuals must be eligible for Medicaid. It doesn't mean you have to have Medicaid prior to applying for the waiver. Part of the waiver process is submitting an application to Medicaid. It's called the long-term care segment of Medicaid, or LTC. There are some forms that need to be submitted to Medicaid when the waiver process has started, and Medicaid gets notified of the waiver offers, and they send something out to the families at some point. But it is required to be eligible for Medicaid, because that is how the waivers are funded. Okay, so for our children or individuals birth to 20 years of age, the Children's Choice Waiver, once someone has gone through the SUN assessment process and they've scored the 3 or the 4, they will receive a waiver offer. And if they're under the age of 21, they will automatically get the Children's Choice Waiver. And then at the age of 21, or prior to the age of 21, I should say, at least 90 days out, planning will then begin for the adult waiver, and we'll talk more about the adult waivers in a little bit. But the Children's Choice Waiver is capped. It can be used in conjunction with the EPSDT services, which are part of the Medicaid state plan. And support coordination is included as a service, as well as respite, family support, and we use the names interchangeably. Family support, you may see IFS, PCA. It's that paid caregiver in the home to assist the family with that individual. Another part of the service package for Children's Choice is environmental modifications, and those are things for the home that will make that home more accessible for the child. For instance, a wheelchair ramp, grab bars, widening of doorways, specialized medical equipment. Waiver is the last resource to use. There's certain medical equipment that can be covered under the waiver. However, the private insurance and Medicaid has to be exhausted first in order to access any specialized medical equipment through their Children's Choice Waiver. And supplies are also included in that. These are our 3 adult waivers, typically for people 21 years and older. And I say typically because there's some little caveats to the supports waiver. And you know, when they age out from Children's Choice to an adult waiver. But these are our 3 adult waivers: supports waiver, the residential options waiver, or ROW, and the new opportunities waiver. And we'll go into more detail. Marla will go into a little bit more detail about these adult waivers on the next slide.
Hi, I just want to let everybody know we do see all your chat, and thank you for some people actually giving some input to everyone on the questions. And I'm so sorry we left out speech therapy. They were a very important component of that team. But we will address any other questions at the end of the presentation. So please continue to fill the chat box with your questions. We're going to go ahead and start with the supports waiver. When you're linked as an adult, this would be the first step. Every adult will begin with this first tier being offered the supports waiver. And so first I'm just going to go through the different waivers and give you just a very brief overview of some of the services that are available. We will include fact sheets after when we send everything out, because at that point it will give you a better information about all of the resources that are available. So the supports waiver main focus is for vocation, for an individual who would like to participate in some sort of job setting or day program. Somebody's not muted, maybe? Oh, thank you. So supported employment, day habilitation, in-home respite, which would mean like a personal care attendant that would come in to fulfill some hours. It is limited. And then there is also the option of center-based respite, where an individual could go to a center-based facility to receive temporary services. Then support coordination is the main component of all of the waivers. And they are there, we call it, to lead the ship. They're the ones that will coordinate all the supports and services and assist the participant to gain access to the needed waiver, Medicaid state plan services. Also, if you have a supports waiver, you can utilize it in conjunction with long-term personal care services, LTPCS. So some individuals find that the supports that they can receive with respite is not enough, but they could become eligible or be eligible for long-term personal care services, which does have a max of the hours they can support, but it is additional hours if you are eligible. That can go along with the supports waiver. And this is also a capped waiver. It doesn't have a dollar amount per se, but the services have limitations to each of them. Next, we're gonna talk about the residential options waiver. And this is a waiver that when I first came over to MCAL, we didn't utilize very much, more of, you know, just it's kind of like it got reawakened. And now we're looking at it with more services, and it's kind of been reborn the way, you know, that's kind of how I feel. It is a capped waiver also. The person's individual annual budget is based upon the person's assessed support needs. So there is a tool that is utilized to determine what that budget would look like. In utilizing the row waiver, there are some musts. With supports waiver, the must was support coordination. With residential options waiver, the must is support coordination as well as community living support. And so that means paid staff in the home, personal care attendants through a provider agency. And I guess I don't want to get ahead of myself, but when going from one tier to another, from supports waiver to row, the big difference here would be is that services in the home by paid staff are not enough in the supports waiver, and there is justification that this waiver would supply more support of paid staff. There's also companion care, and that's where there can be a roommate situation. It is on a per diem rate, and we can definitely get you more information about those services if anyone's wanting a more intense conversation on that. Skilled nursing services, when you were utilizing Children's Choice, those were through your extended home health. Now that you're an adult, if you're eligible for skilled nursing services, that is a billable service through the waiver. Although it being a capped waiver, you know, we do have to look at the budget and the resources and services that the individual needs to determine if this is the most appropriate waiver. There's respite care in a center outside of the home, personal emergency response, which is called a PERS unit. I like to sum it up as the help button that individuals, if they're alone and can be supported alone with just a minor amount of support, or if they're concerned that they could drop their cell phone or that's not the best way to communicate for an emergency, the PERS button might be a really great option to assist. Supported employment, day vocation, day habilitation, so there's day programs again. And with the residential options waiver, you can also utilize funds with your, it has to be within your capped waiver for environmental accessibility adaptations, like modifications to the home, and then assistive technology. And of course, you know, we'd have to run all that through Medicaid first and make sure that those are not services or equipment that could be paid for through that program first. Also Medicare if the individual has Medicare. And then there's one-time transition services, And this is for individuals moving out of the facility into their own home, their own apartment, their own rental or property, not with the family, but on their own. And so it is a one-time service that's available. It assists them with getting their essential furniture and some non-refundable deposits, but it's also kind of that get you started, help you get into the home. In all of these waivers, I do want to mention, we aren't putting on the slide, but one of the most important things is that we all have a village. And we don't want to forget about the natural supports that are already being provided. So I know we're focusing right now on the paid services and paid supports, but just want to remember that with all of our waivers and all of our planning, we still want to hone in on the natural support that individuals already receive, and we're not trying to replace those. Okay, so the next slide we're going to go to is the new opportunities waiver. And I know everyone probably knows about this waiver most, and it could be kind of scary when you're no longer given this waiver at the age of 18 or 21. But we'll go into the tiered waiver process, and I think that you'll be able to get a better understanding of why we aren't going directly to this waiver. You must have support coordination, and then you must have one of the other services. It does not have to be PCA services. However, most individuals utilize this waiver because their needs cannot be met through paid staff with the supports waiver, residential options waiver. So they also are able to receive supported independent living, SIL, where that could be assistance to pay bills, to go grocery shopping, to budget, to make and keep doctor's appointments, prescription refills. There's also the skilled nursing services again, and that is the same as what we talked about with the row. The difference with this waiver versus the row is now it's not a capped waiver, but it is still based on need for support and justification. There is also, again, the other services of the respite centers, PERS, supported employment and day program, environmental accessibility, assistive technology, and the one-time transitional services. So this is really, to me, where the tiered waiver process really gets going, where we're going to really talk about it. The LDH and OCDD implemented a tiered waiver system back in 2018. And this waiver system was implemented to ensure that more Louisiana residents that are seeking home and community-based services are able to receive them at the appropriate level when they need them. So there was a shift from the tiered waiver system. That was also, the goal was to address a 25-year-old waiting list, commonly referred to as the NOW list, so that we could meet needs where the person is at this time and provide the services to them more quickly. So the waiver offers are made now based on the person's urgency of need, and their registry date is considered as well. It's a prioritization process. It provides assistance, like I said earlier, to get services in a more timely fashion. It also is to assist individuals that are at the highest risk of institutionalization and to promote their ability to continue to live in the community. This system also allows for the rescreening process if there are changes or need for support anywhere in that process. So that's good. That's if your needs change, they can be reassessed to determine if a waiver offer needs to be given at that time. So we no longer have that first come, first served process. So there, like I mentioned, the first reason why the tiered waiver, one of the biggest changes was the prioritization process. The next reason is when a person receives a waiver offer, they will be participating in a needs-based assessment to determine the most appropriate waiver to meet their needs at this time. This means that you will not automatically get the new opportunities waiver offer. you will receive a developmental disabilities waiver offer. And like I said earlier, it begins with the supports waiver. And then you go through the tiers. So it's identified through the assessment and person-centered planning. The next change was to align the Children's Choice Waiver with the Medicaid State Plan EPSDP services. So the Children's Choice Waiver now will extend to the age, well, to the 21st birthday. And so that allows things to stay cohesive in that. So if you're receiving EPSDT and you're receiving Children's Choice, this will line up with that. There is a justification system in place if there are additional supports that are needed for someone who's receiving a Children's Choice Waiver. So if you've actually never heard any of my presentations, I love the person-centered planning process. It's probably my very favorite thing to talk about. I feel that it's the most needed process that we can start with. And it really begins with, hi, how are you, hello. All waivers begin with the planning process to start learning about the supports the individual needs and what their unmet needs are. And like I said earlier, if these needs can be met through resources that are already in the community or natural supports, we also want to recognize that in the planning process. This will begin with discovery. And like I said, this starts with, hi, my name is Marla, and you just begin that important relationship and build on what a meaningful life is for each individual, and not limit the services that they have now, but try to just focus on what can we do to make this meet their goals and their vision. And that's the next PowerPoint I would like to explain. And this is just barely scratching the surface of person-centered planning. I mean, I could go on and on. If you know me, I could go on and on and on about the process and about the tiered waiver and the different waivers. But learning about each person's story, how do they want to get a life? What is important for them and to them? So in that process with the person-centered planning, you're finding out about their vision. What are their next steps? Do they have some short-term goals, long-term goals? What are the preferences that they would like to see continue? What are the make or breaks? And, you know, if we really think about it, we all have make or breaks as well, but really trying to figure out what is that? You know, where does the buck stop for this individual? The strengths, we want to focus on what opportunities, connections in the community that the individual has or may be able to tap into, and then environmental positives. And that being like, you know, do you have access to the services that you need? Or you're in a rural area? Do you have resources around you that you can utilize easily or that can be arranged for you? So that would be a positive. Of course, looking at the challenges, the negative would be if those resources aren't there. So if your living situation needs some assistance to change, or the rural area you live in, or the transportation, you know, these challenges may be able to also be addressed through a waiver, but we just don't want to focus on paid supports. We also want to focus on, you know, that village that we all have. Other challenges could be behavioral, mental health, trauma to the individual, medical needs, legal support, skills challenges. So we want to address all of the needs the individual has, but we also want to focus on the attributes and in the supports they're already receiving. So the person-centered planning process, again, I just can't talk enough about how much that's needed and getting to know the individual and how important that is so that we can assist them. So the next thing is, how do we move? Do we move? Do we stay where we are? And how do we really determine that? So if there are still unmet needs, well, let me go back. If unmet needs can be met with the current waiver that you are assigned, then we move forward as a team. Support coordination, the provider that's selected, the participant, the LG is also involved in some steps in that. And so we go with that and we proceed to get those services in place as soon as possible. If there are still unmet needs that cannot be met with the current waiver assignment, of course, we look at resources, we look at natural supports, but sometimes that we don't have those, and that we have to look at other options to be considered, and the unmet needs could be met by another waiver option. And so at that time, justification would be provided from the support coordination agency to the LGE to request the exception process, and we kind of use layman terms like the bump process. So if you are receiving a supports waiver or linked to the supports waiver, and you are requesting an exception process to go to the row, that's determined at the regional level, the LGE waiver office. If you are realizing that you feel you need greater services and the justification is there, and then that justification would be provided again to the LGE office, but it is then sent forward to the Office of Citizens with Developmental Disabilities State Office Review Committee. They are the determining factor for the now waiver. And so they would give us that guidance and approval or denial at that point. More questions could be asked. We could look into more information. We can get some oversight and recommendations. So sometimes it still continues to be a work in progress, trying to determine what waiver and services are really most appropriate. So we hope that in this process, if things change for the individual that's receiving a supports waiver, then we are able to assess that change and then move forward to the next most appropriate waiver so that that individual is met where they are. They're met where their needs are at the time. Also, if there is a denial that is given from the State Office Review Committee, then appeal rights will be offered, but it is only after exhausting the exception process. So it really is a holistic view of the support needs the individual has and going through the tiers and seeing what is most needed at the time. There are some other factors that we look at, in this assisting is making sure if an individual needs a provider, maybe they don't have that service, and that may be something that can be worked out in the current waiver that they're in. And so, sometimes it's just kind of putting our heads together, reevaluating the situation, and seeing what resources can be provided or what information needs to be provided to move forward in the existing waiver. So I'm going to turn it back over to Snow, and then again, we will go through all the Snapchat. Oh, can you tell I have children at home? We'll go through the chat questions and we'll address those.
Okay, hello. This is mine and Marla's contact information. I put our main numbers and our direct lines on this slide. These are our offices within MCAL. Our Developmental Disabilities office is located on Fifth Avenue. And we have 4 behavioral health clinics, one here in Lake Charles, and that one's not. We have our administrative office. We have our Beauregard, Jefferson, Sulphur, and Allen behavioral health clinics listed on here. We also have an MCAL resource app. When we send out all the information to Wallace, we'll attach a link for that resource app. It's a helpful app that you can download to your mobile device. And we're going to go through some of the chat questions here. And thank you, Patricia and Tracy, for letting us know about the speech therapy. I'm not sure if it's available in our.
It is. We've actually been utilizing a speech therapist from one of the other regions. So I think in areas where they don't have the discipline in each region, there is some shared effort. And in this particular situation, she was assisting us with the communication device for the participant and helping them be able to utilize the device that they've had and had some barriers to So yes, that's a great resource. Every opportunity that's offered through the Resource Center, as long as you're eligible for our point of entry where you get the statement of eligibility or approval, then you can utilize the OCDD resource services. So the age range, 0 to 100, like I said, it's just pending the approval of your statement of eligibility through the entry process. Great resources. We're so very happy that we have this to tap into. They're just wonderful.
Okay, well, thanks again, Tracy and Patricia, for posting the Resource Center link and referral form. Individuals can also contact our office. Let me go back to our direct line there. And we can also get you connected if a Resource Center services consult or request is needed. Okay, there's a question from, I think I went through, okay, the referral form. Okay, there's a question about flexible family funds. Okay, so just contact our office and I will get you to the family supports or the supervisor over flexible family funds to see where you are on that waiting list. And to change support coordination agencies, again, please contact me directly and I can help get that process started for you. That would entail me informing our data contractor, statistical resource, to send out or to send the individual another freedom of choice form to select a different SC agency. Like I said, we do have 3 SC agencies now. Okay, and if anyone is on the call, there's a question about services, if they've been approved or maybe linked to services, and maybe the plan has not been certified yet or is still in the planning process and services haven't begun yet, please contact me, 475-8088. Contact me directly and I will get with the SC agency, the family member, and see what's going on with that process. Yeah, can everyone see mine and Marla's contact information?
Yes.
Okay, thank you.
Okay.
Okay.
Are you finished with the presentation?
Yes, I think
Okay.
just where we're just looking to make sure there weren't any other questions or comments.
I was
Okay.
planned asking for the slides to be put back for the contact information, but y'all said y'all can see that. Okay.
Okay. Okay. Well, thank you so much for sharing with us, Marla and Snow. I want to remind you to please complete our post-event survey. Please also tell us what other webinars you might be interested in. These are free opportunities to gain knowledge and learn about new resources in and around our community. On behalf of Families Helping Families of Southwest Louisiana and MCAL, we would like to thank you again for joining us for this webinar. Have a good afternoon.